Hello, everyone. It's Wednesday, November the 30th. Thank you for being with us and everything. We've got 15 additional deaths since the last time we were here. I ask again for your prayers and everything for these great people and all their loved ones, and especially if you know them, please reach out. Please reach out. The 7,591st death is a 93-year-old female from Wood County. The 7,592nd death, a 103-year-old male from Nicholas County. God bless him. Think of the wisdom. Think of the wisdom that this great man has given us and all these great people. It's unbelievable. The 7,593rd death is a 68-year-old male from Summers County. The 7,594th death, a 51-year-old male from Fayette County. The 7,595th death, a 54-year-old male from Cabell County. The 7,596th death, an 88-year-old male from Kanawha County. The 7,597th death, a 75-year-old male from Mingo County. The 7,598th death, a 51-year-old female from Marshall County. The 7,599th death, an 86-year-old female from Raleigh County. The 7,600th death in West Virginia is a 63-year-old female from Jefferson County. The 7,601st death, an 89-year-old male from Kanawha County. The 7,602nd death, an 80-year-old female from Wyoming County. The 7,603rd death, an 80-year-old female from Summers County. The 7,604th death, a 71-year-old male from Mingo County. And the 7,605th death in West Virginia is a 96-year-old female from Cabell County. Dang, I hate it. I hate it so much. You know, in this we lost two 51-year-olds, young people, a 54-year-old. But really and truly, we're losing our wisdom. You know, we're losing the folks that have taught us so much, and it's so sad. It's just, please keep these folks in your prayers. Active cases, 785, new positive cases, 327. You know, the daily positivity rate, 5.36, the cumulative rate, 8.53. Recovered cases, 606,250 people in West Virginia. 162 hospitalized, 20 in the ICU units, and 7 on ventilators. Most of our counties continue to be green, 14 yellow counties. You know, this seems to be big news today, but you're aware now that I recently issued a proclamation which terminates the COVID-19 pandemic state of emergency in West Virginia effective on January 1st, 2023. The reason we did this now is to provide adequate time for any outstanding emergency rules to be lifted and for the statute regulations to be reinstated. You know, now the truth is the state of emergency doesn't affect a whole lot, you know, anymore. You know, there was a time when we used this state of emergency and we used it in a way that was prudent, did we not? We absolutely did and pushed the right buttons at the right time. Now it's no longer needed. You know, you may say, well, why didn't we make a big deal out of it? Well, because in my world, I see no reason to make big deals out of stuff. You know, at the end of the day, I was taught a long time ago, the only shot that matters in golf, the only shot that really matters in life in many, many ways is the next shot. You can't do anything about what's happened. And really and truly, we used this state of emergency situation in a really good way. We absolutely all held the rope and pulled the rope together, and look what happened. West Virginia, the third oldest state, the state that abounds in all kinds of chronic illnesses all across our state and everything, with all that and the fact that so many travelers come right through West Virginia all the time. We absolutely could have been in a world of hurt, but literally we did it and we did it right. You know, we didn't get carried away like a lot of other states, with their emergency powers and everything and shutting stuff down and everything. We, for all practical purposes, kept stuff because they were essential businesses. Think about it. Whether they be Kroger's or they be, a shopping center and everything, or whether they be our manufacturing or our coal mines or whatever it was, we kept them all running. At the end of the day, there was a lot of really tough decisions that had to be made, and they had to be made, and they had to be made right. And we did it, and we did it right. So with all that being said, there was no reason to get up on a soapbox and turn this thing into a political issue and everything. There's no reason to do that. So it was a couple weeks ago or whatever like that, we issued this proclamation to lift the state of emergency, and I saw no reason to make a great big hoopla out of it. But nevertheless, I can tell you just this, and I want you to really listen. We've learned to live with this pandemic, and that's what we're going to have to do, because if you'll just look at these numbers, in the last month, we've lost 97 West Virginians. Over 4,900 West Virginians have been tested positive in the last month. Close to 200 West Virginians on average have been hospitalized in the last month. We crossed over 1 million West Virginians who were fully vaccinated. Over 4,000 West Virginians decided to get their first dose of vaccine in the last month. 4,000 West Virginians got their first dose of vaccine in the last month. So the state of emergency will now be officially lifted on January the 1st. But you should keep in mind that those that are still battling this disease, we should keep them in prayer. And absolutely we should know that this thing isn't going to go away. It's not going to go away for a long time. But we can live with it. I urge you with all in me to be vaccinated. But with all that being said, I absolutely am so respectful of your freedoms. You see, we didn't do what a lot of governors did, that held a sledgehammer over top of you and everything. We didn't shut things down right and left and everything. We kept our state running. It's tough stuff. I'll promise you this, that there wasn't any playbook. We all did the very best that we could possibly do. But my dad would say over and over and over, son, just doing the best you can do isn't good enough. Son, effort, don't ever confuse effort with accomplishment. And I am very, very proud to say that the team around me and all the folks that really pulled the rope really, really hard accomplished. And I'm really proud of them. Really, really proud of them. So thank you, especially to all the experts that are on with me now, but lots and lots and lots of folks deserve a lot of kudos for this, because we've done the right job here. I remind you about your Omicron booster shot, and I remind you about getting your flu shot. The numbers continue to crawl, slow but sure. But if we've got 4,000 people to get their first vaccination in the last 30 days, just think, I've said it 1,000 times. What is a life worth? What's it worth? If you got 4,000 people vaccinated, how many people did we save? How many people's lives were saved there? At the end of the day, if it's one, it's off the chart. Absolutely, but with all in it, it could be very, very significantly more than that. The vaccine calculator on the website, our COVID vaccine info line on the website, 34 outbreaks in our long-term care facilities, none in our church community, 18 inmates and 9 staff cases. We should be saluting corrections for the great job they've done. Homeowners Assistance Program is still available to you. There's a Housing Development Fund update. The West Virginia Housing Development Fund is now offering mortgage assistance payments up to $20,000. And if you If you qualified in the beginning for our homeowners assistance program, you now may qualify, you may very well be qualified now for additional assistance up to $20,000. You need to contact the West Virginia Housing Fund and do so right now, because it could really, really help you out. It really, really help you out. I remind you about giving blood. You know, as I promised you, DHHR would have major announcements on Monday and everything today and everything. Secretary Crouch has, you know, Secretary Crouch appointed two new deputy secretaries. He'll tell you about that in just a second, and is doing centralized, you know, work, you know, in the reporting structures of his key staff. Cammie Chapman and Christina Mullins are uniquely qualified to help and lead the transformation of DHHR into a better and more responsible agency. I tell you just this, I can't be any more blunt and just tell you the truth. You know, there's been problems with DHHR for decades and decades and decades and decades. Now, again, we can jump up on that soapbox and make a big political thing of it, or we can do smart stuff. What do? Smart stuff. We got the best of the best to come in here and absolutely do us a top to bottom, you know, evaluation of DHHR in every way, and then give us recommendations. And they did so. And we're following those recommendations. We'll make it better. We won't make it perfect, but we'll make it better. And we'll make it better in a way that we won't risk losing funds coming from DC and then be standing there holding the bag wondering what in the world happened and a bunch of people really hurting. So at the end of the day, let's just continue to try in every way we possibly can, just continue to make things better for all of us. Joyful Nights, you know, Kathy and I are going to be doing a bunch of stuff on that. You know, it's Thursday. It's Saturday, December the 3rd, and you know, I think our curator of the arts, Randall Reed Smith, has got a little video here and everything. But we welcome all of you to join us outside. You know, on the Capitol steps and everything. It'll begin at 5:30 on Saturday, December the 3rd. You know, on the south side of the Capitol, rather, and you know, there'll be musical performances by the Cabell Midland High School Marching Band and the Capitol High School VIPs. So much good stuff and everything that we should be incredibly thankful for. And you know, I appreciate all your prayers in every way and everything. You know, our daughter Jill just had her third baby and everything. The baby's still having a few little issues, and Jill's doing pretty good. And but we hope to have them home real soon and everything. But a little baby girl, and all's real good. Her name's Collins Lee, and Collins Lee Long. And so, but the long and the short of it is, we've got so much to be really, really thankful for. Yesterday I announced that I have appointed Frank Foster. Now, for those of you that know Frank Foster, if you know anything about the mining industry, you know Frank Foster. He's been around a long time, 45 years of experience. So I just appointed Frank as our director of the Office of Miners Health, Safety, and Training. Now, I say this over and over, but I mean it from the bottom of my heart. You know, our coal miners, they get their dinner buckets and they go to work, and it is a tough industry. There's no questions about it that it is prone for accidents, and we've got to have the best of the best looking after those people in every way, and that's why I appointed Frank Foster. You know, I thank Eugene White. Eugene has held that position for a good while, and Eugene, what a superstar you've been, and we can never ever thank you enough, and we wish you the very best in your retirement and everything. And we thank Kenny Browning. He's going to move from the acting director to our deputy director, and Kenny's done a fabulous job as well. So great team, and we thank them, and we pray that they'll make the right decisions always to just keep our miners safe and do really, really good stuff for our miners. You know, we also have, yesterday I received the resignation of Delegate Nathan Brown, who represented parts of Mingo and Logan counties. Delegate Brown was recently elected to the Mingo County Commission, and his duties begin tomorrow, so he is resigning from the House. Delegate, we thank you so much, and just keep doing great stuff down there in Southern West Virginia. You know, a lot of good things happening in Southern West Virginia, and we just want to keep it going all across this great state. Thank you so much. That's all I've got.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, good morning. And in following up with what the governor said, we are seeing a slight increase in the number of West Virginians that are hospitalized today with COVID-19. On 11/23, we were 114 West Virginians in hospital beds around the state. Today, we're 169. And that may be anticipated following the holiday break with people getting together, but also most likely reflects an increase in the number of new variant cases that we're anticipating seeing in the near future in West Virginia. As we've talked about, the COVID-19 virus continues to mutate at a relatively rapid rate. And because of that mutation, it's constantly making new changes in its genetic structure. And BA.5, if you remember the Omicron BA.5 variant, which is the variant that the new Omicron booster shot is directed against, was at the time it gained superiority in our country, which has been about the last 6 months or so. That was the most infectious form of COVID-19 that we had seen to date. And it compared with the level of infectiousness that we had seen with the measles virus, which is one of the most infectious viruses we've ever measured. This new variant set, which are descendants of the Omicron BA.5 variant, the name BQ1 and BQ1.1, are now combined the dominant variants in our country, and they're starting to rise in West Virginia. And as we've talked about many times, there's almost always a few-week delay in when West Virginia starts to see the brunt of the variants change. And we had seen a jump in the last sequencing run we had done, and we're going to do another one soon, which we anticipate will further show increases in the BQ1 and the BQ1.1 variants. The reason why that's somewhat important is because these new variants, particularly the BQ1.1 variant, has been assessed and is found to be about 7 times more infectious than the BA.5 variant, and about 170 times more infectious than the initial variant from Wuhan, China. And despite the fact that more and more people have some form of immunity from getting vaccinated or being infected and recovering from that infection, we know that these new variants are so infectious that even being previously infected and recovered, or even having gotten your COVID vaccines, is no longer an absolute guarantee that you will not be infected by these new variants. So it is important that people do stay up to date with their vaccines, because we know the vaccines, the most recent Omicron booster shot, does protect people who are the most vulnerable from death and hospitalizations, even from these newer variants, from the BQ1 and the BQ1.1 variants. But these new variants are able to bypass much of the immune response, particularly the antibodies that we make in our body, and also the antibodies that we used to give. Remember the monoclonal antibodies we gave people who had COVID? These variants no longer are impacted by those antibodies. And so these variants are much more infectious. And we're seeing the number of people that are getting sick from COVID to the level of needing to be hospitalized and dying getting older and older. We now have seen about 90% of people who have died with COVID-19 over the last month or two be over 65 years old. So it's really pushing out to our older population. And that's why it's so critically important that we have people stay up to date with their vaccines, because nationally, only about 31% of Americans over 65 have gotten their updated COVID booster shot. So these vaccines really aren't an absolute guarantee that you can't get reinfected, but what they do is really still very powerfully protect you against getting severely sick or dying from COVID-19. And as we've talked about before, we're still losing between 300 and 400 people a day from COVID-19. We've lost 1.09 million people from COVID infection, and we're on target to have between 250,000 and 300,000 Americans die of COVID-19. And I'll end with this. There's a recent paper that came out of Harvard, which looked at all the states and looked at the current risk of either getting infected, reinfected, or having more severe complications and deaths. And West Virginia was #1 on their modeling risk state group. So it is really important for us not to let down our guard. As the governor said, we are so thankful that so many people have chosen to protect themselves and protected their community and our vulnerable population. And it's time for us not to let our guard down, particularly with the winter months coming in play. And Governor, I'd like to congratulate you and Jill and your family on the birth of your new granddaughter. Thank you.
All right, thank you, Dr. Marsh. Next to retired Major General Jim Hoyer, the director of our Joint Interagency Task Force.
Good morning, Governor. I too would like to congratulate you and Kathy and Jill and Adam and the family on the new addition. Also, I think it's important to point out that Sunday we hit 1,000 days in our task force response. So on behalf of all of this team, the governor, I want to thank everyone from our healthcare workers to our public health workers to all the organizations that have participated in the governor's Joint Interagency Pandemic Response Task Force and the team that has managed this threat. As I mentioned last week, we have surpassed the equivalent today of the population of Pleasants County with the number of West Virginians we've lost, but could have been much, much worse had we not responded the way we had. Want to let folks know, for particularly those with young children, 6 months to 5 years of age, that there is an anticipated FDA authorization of vaccine for those young West Virginians. We are in the process as the task force of working through the logistics to be able to support that for families who choose to take advantage of that. Next week, the 5th through the 9th of December, is National Flu Vaccine Week. So please go out. As Dr. Marsh, the governor, have both pointed out in recent comments, in addition to COVID, we are managing significant challenges with RSV as well as flu, and we have yet to hit the peak of flu season. So please go out and get a flu vaccine. You can also get your Omicron booster at the same time. It is not only an option, but it is recommended to get both the Omicron booster and the flu shot at the same time. Remember, it takes about 2 weeks for immunity to fully kick in from those vaccines. So the sooner you can do that, the better. And I think it's, again, really important to point out that both the governor and Dr. Marsh have pointed out in the last couple of months in our country, over 90% of the deaths that we have seen from COVID have been people 65 and older. So please consider the flu vaccine and the Omicron booster if you're particularly over the age of 65. Thank you.
All right, thank you, sir. And next is Secretary Bill Crouch with the DHHR.
Good morning, everyone. Congratulations, Governor and Kathy, on the grandchild. I know from experience that's one of the most exciting things that can happen in your life. So I hope Jill and Colin, I think you said, are doing well. So congratulations. I want to also mention the 1,000 days. Our DHHR Center for Threat Preparedness has been standing up. The 1,000 day was Sunday. I think at the start of this pandemic, it was unimaginable that we would be dealing with this long, and we're still dealing with this, as Clay said. And I want to thank guys, especially the governor, for his difficult decisions throughout this pandemic that have saved lives, but also Clay Marsh and WVU, and thank you, President Gee, for loaning that play to us through this pandemic, and thank Jim and Joe Peel, Jada, and Dr. Amjad, who was parachuted into this and right in the middle of it, and was fearless in going throughout the state and assisting anybody that had outbreaks out there, and donning whatever protective gear she needed to do that. So thank you, Elaine, for all that. But our health command, started by Donnie Haynes and now led by Tim Pretty, has done an outstanding job. I want to thank Shannon McBee quickly, and Amy Atkins and others for all their work on this pandemic. I've said before, there are a lot of folks behind the scenes whose names we'll never know, who spent hours and long nights and weekends trying to keep folks safe. So thank you all for that. As the governor mentioned, we began implementing the McChrystal report earlier in the week. I did appoint named two individuals to deputy secretary positions. I'm very excited about that. These folks are extremely qualified and committed. They've been public servants for some time, and I talk about finding public servants who are committed to the job. And these are two outstanding individuals: Tammy Chapman, Deputy Secretary for Child and Adult Services, and Christina Mullins, who's the Deputy Secretary for Mental Health and SUD. Two of the primary areas that we're focused on in DHHR, and two of the areas that McChrystal focused on as they learned how DHHR operated and what we were doing. So in addition, though, we're centralizing the reporting structure for staff who work in job functions in finance management, management information, human resources, and purchasing. These individuals have been spread throughout DHHR and the bureaus, and some of the comments in the McChrystal report with regard to silos is essentially aimed at each of those bureaus having individuals who function with regard to those particular areas that I've talked about kind of independently, and we need better communication with the Secretary's office and with our Chief Financial Officer for DHHR and our MIS Director and our HR Director and others. So we're centralizing those to, again, break down those silos. We also, I've also placed a temporary hiring freeze in place. That does not include critical positions in DHHR. We clearly have some responsibilities there that we cannot in any way impede. So that does not include CPS and APS workers and others in those areas, as well as key positions like Inspector General. We're recruiting for that position right now, and the position of Commissioner for the Bureau of Public Health and State Health Officer position. As you know, Dr. Amjad is now on a contract and is phasing back into her practice. So we're recruiting for that position as well. Positions that are already posted to Division of Personnel will still be filled and hired. We have job fairs scheduled. Our state facilities will not be impacted by this freeze. There are critical positions there that we'll continue to fill. But the intent of this is to make sure that we can do this within the resources that DHHR has. We're implementing these recommendations through from the McChrystal report through the existing resources we have, and I believe we can do that without going back and asking for additional dollars to implement this. So I want to mention that these organizational changes will continue, and that we'll be open with regard to pushing those changes out to the public and be transparent in what we're doing as we do that. So that's been something that the governor has required throughout my tenure with him, and we'll continue to do that. By getting the right people in the right places, we will continue the critical work that DHHR is responsible for. So thank you, George.
Great, thank you, Secretary. Dr. Anamjad, our state health officer, is also joining us today and is available for questions. We'll now go to questions from members of the media. The first today from Brad McElhenney with West Virginia Metro News.
Hi, Governor. Hi, everybody. Thank you all for your steady hands on the pandemic. It is a milestone to clarify that the state of emergency is coming to an end. That's a real relief, although I do understand that people still need to be on guard. Has the emergency declaration still been affecting state government in ways that people might not have noticed? Why was it still in effect in the first place? For example, was it still affecting purchasing requirements for state government? Thank you.
Brad, I think that there's no question that it affected a lot of things within state government, but the right answer is, to the very best of my knowledge, is just this. While we had a real live emergency and had a real live reason for an emergency response, we kept it in effect and we utilized it properly. Now, and then there was a period of time when I was just demanding of all my people that we double checked and we triple checked and we triple checked, that with the lifting of it, that really we would not jeopardize any federal dollars that could come to us. So really and truly, the bottom line is there's no need right now that we see it for an emergency response. There's absolutely, we have double, triple checked to the very best of our abilities that there's not Fed dollars or federal dollars out there that we're going to lose in any way. Absolutely, we handled the tool that we had efficiently. And I congratulate all those that are on this call in every way, and everyone all across this state that pulled the rope. Just think, Dr. Amjad, think of the times when she had to put on protective clothing and go into nursing homes or hospitals or whatever. Think of Dr. Marsh. Think of absolutely the National Guard and all the incredible stuff that they did, led at the time by General Hoyer, now, General Crane. Just think of all the stuff that our doctors and nurses and the health centers and health clinics and everything. Think of the guy or the lady that went to work at the grocery store just so we could get essential food supplies. I mean, absolutely, it's unbelievable to think 1,000 days on last Sunday. Absolutely, with all in me, we don't ever want to make this a political stunt, do we? At the end of the day, we used the emergency powers and absolutely declared an emergency at the time that we had an emergency. And now we've checked and checked and checked, and now we need to move on. And that's exactly what we're doing. So Brad, thanks for the compliment and everything, but thank you for all you've done. I mean, think about the media. Think about how they stepped up. All of you. Everybody has stepped up to try to inform our people and to try to educate, to try to help our people in every way. You deserve a lot of credit. I thank you.
All right, thanks, Brad. Next to Randy Yohe with West Virginia Public Broadcasting. Yeah, Randy, you may be muted. All right, we'll come back to Randy. How about next to Bob Aaron with WCHS and Fox 11?
The changes that the DHHR announced today, do they add another level of bureaucracy or do they reduce it? In talking to former employees and current employees, that massive level of bureaucracy seems to be a problem for the agency, that there are so many levels that people have to go through, some of it necessitated by federal requirements, but it still seems to have a lot of cumbersome features. Is this cutting that or adding another check for reasons that you have?
Well, Bob, I'm gonna let Secretary Crouch answer and everything, but these are employees that are existing within DHHR. We've elevated them to a higher position to be able to facilitate and help in communication. From that standpoint, I think streamlining, again, what we're trying to do is follow guidelines and everything from the report that we've gotten. But Secretary Crouch, if you can add to that, please do.
Thank you, Governor. I'll do that. And thank you, Bob. We're not adding an additional layer, Bob, into the organization. We've always had deputy secretaries. These individuals were in different positions and have been promoted to the level of deputy secretary, and we will fill their positions so that there's no real change from that standpoint. We may have a change here with regard to the number of deputy secretaries, but that level has always been there. So there will be no change. Part of the change with regard to reporting and communication by folks in bureaus who have responsibilities that end up in the hands of DHHR, for example, the finance folks who ultimately make those final calls. They'll have direct reporting now to those people, so that there's no change there or addition. In fact, I really believe we may be able to save some positions there, which is what I was talking about regarding using existing resources. So there's no additional levels, there's no additional change with regard to numbers here. We're moving people around. Again, the positions that will be vacated since we've moved these two individuals up, we'll fill those with the best people we can find. You've got to find the best people. My plan is, my hope is to bring some new blood into West Virginia, some new eyes and some new expertise. That takes a little longer in government. So, we're looking at maybe weeks to a month or so to try to do that once we post those positions. And then there's a learning curve for those folks. So, but we want to get some new folks in here too, give us some new perspective on them. Thank you.
Bob, let me add just one thing, and you can go back and research this and everything. You'll find that since I've walked in the door, we've significantly reduced the number of government employees, and we've done so with keeping a budget, relatively for all practical purposes, at a flat level. We've kept benefits flowing. We've not increased PEIA dollars as far as their premiums, and there's been so many things that we've done. You can go back and research that and research in every way. I'll tell you this, as we go forward, Secretary Crouch is speaking of new people, young people and everything, and this isn't a pitch or a sales deal, but really and truly, if we can get on a pathway now of really reducing our personal income tax, we'll have a flood of people come into West Virginia. And as we have a flood of people come to West Virginia, maybe that will be a time that we'll need additional people and, throughout government and everything. And so that'd be a great celebration if we had a bunch of people that flooded into West Virginia and a growth in West Virginian population, a significant growth. And we had a lot of young people coming and everything, and a lot of excitement and a lot more good things happening in West Virginia.
All right, thanks, Bob. Next is Stephen Adams with Ogden Newspapers.
Yeah, Stephen Adams with Ogden Newspapers here. Governor, I know you don't want to make a big hoopla over ending the COVID-19 state of emergency, but I am curious as to when you did plan to say something about this, considering this proclamation came out nearly 20 days ago, and nobody knew about it until a former reporter stumbled upon it last night and posted the proclamation on Twitter. So had it not been discovered inadvertently last night, I'm curious to know whether you would have said anything about it today had that not been found out. And was this meant to head off the legislature, who some have said would likely have taken action on doing a resolution to end the COVID-19 state of emergency on their own? And final question, will we, after January 1st, will we see changes to these types of briefings? Will we return to in-person briefings? I think the last in-person briefing that we've had in the governor's reception room would have been around March 18th, 2 days after the state of emergency. Thank you.
Okay, Stephen, you got a lot of questions there and everything. I'll give it my best and everything, but you know, from the standpoint of short hopping the legislature doing something on their own, I mean that's ridiculous. I mean, the only reason in the world, you know, that I didn't want this to be a soapbox political deal. I mean, that's all there is to it. It's too important. You know, we've lost 7,600 plus people. 7,611 people in West Virginia. I mean, for God's sake, to live in, you know, when are we going to quit trying to you know, make something, you know, some hoopla, you know? And so as far as being perfectly honest and saying, you know, would I have announced this today? Probably not. And the reason I wouldn't, because, you know, a lot of my you know, thoughts and prayers and everything in the last couple of days have been with my daughter and my granddaughter, and Kathy and I have been surely occupied a little bit with that. But I would have announced it real soon. And the other thing, it doesn't go into effect until January 1st. We had plenty of time. You know, as far as through the summer and everything, as far as, like I said before, about people, you know, double, triple checking and make sure that as we lifted this, that we would not run into conflict in regard to the federal funding, and we wouldn't miss a dollar, you know. But the time for, you know, an emergency was then, and the time for an emergency response is not now. You know, Dr. Marsh refers to this as an endemic, not a pandemic, and what an incredible, you know, coronavirus czar he's been. I mean, it's unbelievable. You know, Stephen, in regard to the in-person, you know, press conferences or whatever like that, you know, Stephen, I'm all over the state all the time, and you know, the press is you know, asking me questions and everything wherever I am all the time. You know, this has worked pretty dadgum efficiently and everything, because we let people ask anything and everything they want to ask. I'd say we'll do this and the other. You know, I have no problem whatsoever going out, you know, in the governor's reception area and meeting with people, because I'm doing it all the time. You know, I've got the press asking me questions right up in my face all the time, wherever I am. And I'm not sitting in a bunker somewhere all huddled down. I'm out there with the people all the time. I welcome any and every question all the time, but this has worked pretty dadgum efficiently and everything, and so I think we'll continue this to, you know, along these you know, ideas and ways as well.
All right, thanks, Stephen. Next to Mark Curtis with Nexstar Media.
Good morning, Governor and cabinet members, and congratulations on being a grandpa 3 times, Governor Grandpa. Listen, I have a question on a whole different matter here. The U.S. House and U.S. Senate are going to vote probably this afternoon on a bill that would help avert a rail strike. And I know that's a particularly big concern in this state with the coal industry and how much coal is transported by rail. What are your concerns about the potential of a rail strike, and what impact could it have on the coal industry in this state, and how damaging could that be?
Well, Mark, you know, I'm pretty dadgum familiar with the railroads, and because our family's been in the coal business forever. You know, like I said, I've said it a billion times, you know, but, you know, from the standpoint of, you know, how we handle things today, you know, I'm remotely involved from the standpoint that I talk to my children from time to time, you know, over a weekend or whenever it may be, if I get a chance, you know. I go around, but I don't try to tell them what to do. You know, they look after the stores. Now, with all that being said, though, if I could tell you from firsthand experience that this is really serious, really, really serious. You know, will it happen that we'll have a rail strike? I think it's now to the point in time where it very well could happen. Will it last long? It won't have to last long to cause all kinds of problems. All kinds of problems. I mean, this could be a catastrophic move for this nation. Already right now, We have all kinds of freight issues, all kinds of issues, not on coal, not just on coal, but on every product. Every product. You can't get the products and everything. And so it's terrible again, and I think it is a dropping of the ball from the Biden administration in a great big way. Think about what we're doing right now. We could actually have a rail strike 2 weeks before Christmas. Think about that. I mean, literally at the end of the day, that could cause a lot of heartache to all of us and everything. So it's really serious stuff. It should have never, from a standpoint of a president doing his job and doing what ought to have been done, this should have been absolutely put to bed a long time ago. It is very serious. There's no question about that, and we should absolutely be concerned. We should be concerned for our coal miners, like you said, but there's a great bigger picture. This is going to affect every last one of us. And if we have a rail disruption for 2 or 3 or 4 days, it'll be bad. It'll really be bad. And God forbid if we have a rail disruption for significantly longer than that. But there's no call for it. There's just no call for it. I mean, that's all there is to it. It's just dropping the ball again and bumbling around, and I can't say it any other way.
All right, thank you, Mark. Next to Sarah Sager with WSAZ.
Hi, yes, I have 3 questions for Secretary Crouch. So bear with me. Secretary Crouch, what do you say to some criticism of how the restructuring of DHHR is going, that we're just reshuffling people within the department and expecting different outcomes? That's my first question. Second question, are there any more announcements expected this week regarding any of the changes within the McChrystal Group's report? And a third question for you, Secretary Crouch, are you open to in-person interviews? And if so, I'd like to request one. I've been working to try and get an in-person interview with you since the beginning of the year, even asking the governor if he would help me get an in-person interview with you. So just putting that out there on the record, I'd like to get one. Thank you.
Secretary Crouch, please answer.
Thank you, Governor. Thank you, Sarah. I think there's going to be criticism regardless of what I do at this point. DHHR is under a microscope here, and we do a lot of good things every day for a huge number of people in the state, tens of thousands of people in the state. So I'd like to focus on the good stuff, but I know a lot of people want to focus on other areas that they think are failures. We're focused on those issues that I talked about a little earlier, which are child welfare, and the SUV problem, which have been priorities for us. The outcomes that we expect are going to get better, and I talk about child welfare a lot, and we still talk about children being out of state, and that's something we're trying to fix. But we've increased salaries for CPS workers by 35% in 3 years. I don't think any other state has come close to that. We've added retention bonuses at 2 years and 5 years. We've added sign-on bonuses. We've added call pay. We've increased the child welfare workforce by 184 people. 184. So we're increasing the number of individuals who take care of our children and who we need and who are heroes for us. It's a difficult job. So retention is still a problem. Retention has always been a problem. So we're doing all these things to try to fix that. FPV is the same thing. We've done a tremendous number of things with regard to programs to divert people who law enforcement confront and get them into treatment instead of taking them to jail. We have quick response teams, I think, in 35 states. We have done a huge number of things in this state to impact these issues, but we have to do more. So we're putting the right people in the right positions to see more and good outcomes, to see better outcomes. So that's the goal here. So, whether you have one department or whether the department would have been split in two, You're going to have boxes. You're going to have 2 organizational charts to talk about doing the same thing. We have a group, and the McChrystal report showed this, that we have a group of commissioners who are so committed and so qualified, who communicate well. We had 3 commissioners invited to a meeting at the National Medicaid Administrators Association to speak on how they work together with regard to mental health services for children. We have 6 mental health teams throughout the state for children. We have a toll-free number. So we're doing a huge number of things to impact these issues. So now getting the right people in the right positions, we're going to see better outcomes in the future. Thank you, sir.
Gordon, you got to come back to me just a second. You know, Sarah, you know, let me just say this, because in the last conversation we had, you know, I asked you just to be fair. That's all there is to it. Now let me just make just a couple comments. First of all, there will always be something. There's always going to be a problem. This agency is a big agency. There's always going to be a problem. There's going to be a problem somewhere. But there's so much good that's going on, it's off the chart. There'll be tough issues no matter what, without any question. If we focus on, you know, and I say this over and over, you know, when the minister or the pastor is giving his message on Sunday morning, if we absolutely just watch every move he makes and without any question, you know, we may think, well, he tied his tie wrong, you know, and so therefore we focus on that. And I'm not saying we're doing that, but what I'm saying is just this, is there's a lot of good going on. And there is some tough stuff that we absolutely need to try to improve. All I am trying to do with all in me is make that improvement without doing one thing, Sarah, and this is so important. There was a family that wrote to me back, you know, when all this was going on, you know, at the last general session. And the family wrote to me and said, if we do X, their daughter, and, you know, I'm not going to mention her name, is, you know, she's receiving a drug that is now federally funded that is big money. And she won't be able to get that. And it'll be really, 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 really tough. Sarah, if we don't watch out, and that's what I am trying to do, I am trying to get through the wickets and not absolutely, surely not get on a soapbox. I am trying to get through the wickets and make improvement without us absolutely making a move that loses funding or gets us hurt. So what do? We got an organization to come in and do a gigantic report. How long's it been since that report has been here? Not long at all. You know, Sarah, we can't just jump up and just start stabbing it in every direction in the world here without the potential liability of making a big mistake and hurting some family. Just like that young girl that I talked about just a second ago. You know, and so there's no chance that I'm going to do knee-jerk reactions. I'm the most impatient guy in the room. Sarah, I want real improvement now. And absolutely, I will work as hard as I possibly can to provide and get real improvement without blowing our legs off, you know. And so I don't know any answer that's any better than that. Without any question, you know, I'll absolutely urge Bill Crouch to talk to you, and absolutely you be interviewed, you know, or him be interviewed by you. I think it's great that he does that, but you've got to give him just a little bit of time and a little bit of wiggle room here to put into motion a report that was a gigantic report. Now, I'm not an expert in the medical fields. I'm not an expert in all the different areas that DHHR deals with, but I can assure you, Sarah, with all in me, I am an expert in this. I'm an impatient guy, and I want results. And absolutely, with all in me, if we don't have results, we'll have different players. That's all there is to it. And they know that. And so I thank you for your question. I thank you for your interest. I know I know what a wonderful, wonderful, news person you are, and we're going to keep at it. Thank you.
All right, thank you, Sarah. Next to Katie Coyne with the Charleston Gazette-Mail.
Hi, Governor. I was wondering, I have two questions here. I was wondering if you could give specifics of how the emergency declaration helped us in the beginning. I know you said generally that you utilized it and utilized it well, but specifically how, and how that's waned over the years. And then second, respectfully, I understand you said you don't want to make a hoopla about the end of the declaration, but we're holding these press conferences several times a week focused on COVID-19. What's the point of that if not to share COVID-19 updates when they happen?
Gosh, was this Katie? Is it Katie? I'm sorry. Somebody help me with the question. I can't understand.
Governor, can you hear me okay?
I can, but hold on just a second. They're going to type it out for me. Just wait 1 second. Well, Katie, I think the first thing was how did the emergency declaration help us? Well, it gave us incredible flexibility. It gave us the ability to move and to move really quickly and everything. It's just exactly what the emergency declaration is supposed to do. It gave us the ability to put our National Guard and give our nurses and our doctors flexibility. It gave us the flexibility to really look after our businesses and our people and everything in a way that we did. And for all practical purposes, we kept our state running. Now, again, you'll never pitch a perfect game, but with all that, I think we did exactly what we should. Now, there was another part to the other question and everything. Maybe could you tell me the other part, please?
Can you hear me? I can repeat it.
Okay, try it, please.
Okay. I understand you said you don't want to make a hoopla about the end of the declaration, but we're holding these press conferences several times a week that are focused on COVID-19. I'm wondering, what's the point of holding these if not to share COVID-19 updates when they arise like they did almost 20 days ago?
Well, Sarah, my first thing is just this. Just think. No, and I'm not Sarah. I'm sorry, Katie. Just think. Today, if you're looking at me and everything, there were 15 people died. That we hadn't reported. Think of the Sago mine disaster, where there was 12 great miners trapped. We lost 11 in the beginning. We lost 15 people here. And I have absolutely tried and to go through and read every person, not name, but their age, their sex, the county in which they reside, and to try to do that in an onerous way to them and to their families. That's one reason. The other reason is just this, and what we've tried to do is throughout all the pandemic and everything, we surely tried to keep you abreast of everything. Very, very, very soon, what we'll do is we'll still read the names, or read the people in their honor, But we'll turn this more into a, if we're doing we're doing 2 a week, and we'll try to keep up with doing 2 a week. We'll do at least one. That really won't have anything to do with the pandemic, and then 2 is we'll still allow any question or whatever it may be and everything, but we will relate back to all the stuff about the pandemic. But there's many great things that are going on all across West Virginia, and we'll turn this into an update about the things that are going on in West Virginia to let you ask anything you want to ask about anything. Maybe have the ability to bring on our secretaries and let them give more detail about what they're doing in different places and everything. But really and truly, I do feel that the emergency, to continue to call this an emergency right now. We can always go back if it whiplashes on us and everything. We can always go back and declare another emergency. But from the standpoint of the emergency today, I think it's time to move on. I really do.
All right, thank you, Katie. Next to Randy Yohe with West Virginia Public Broadcasting.
All right, I think I've got the microphone fixed. Can you hear me okay now?
Yep, we got you.
All right. So just a couple of non-political housekeeping questions regarding lifting the state of emergency. Will this change how West Virginians receive vaccines? Will insurance continue to pay for them? What does this mean for the National Guard and local health departments and the DHHR? And will the task force step down?
Randy, I can answer that, and I think I can pretty much say to you, it's not going to change much of that at all. But I've got my chief of staff with us today. That he's not in my office. He's outside and everything, but he's also on the Zoom thing. And Brian, maybe you can touch on that. But go ahead, Brian.
Yes, Governor, and hello, Randy. I'll defer to Secretary Crouch on the actual insurance payments, but as far as how the Guard operates and how DHHR or the GIAF respond, the public won't see any real change to that. The West Virginia Guard had transferred from a full-time Guard status back in the summer to where we now, what Guard members we have on duty we're getting reimbursed through FEMA. As the Governor had talked about earlier, he wanted us to double and triple check to make sure nothing from a federal level was going to be missed. So that's what we've done. And you need to think about this as the Governor used this emergency order not as a hammer but as a shield to help the people of West Virginia. So the only things that have been in effect and continue to remain in effect and will be through the end of the year are things that we've put in place to help healthcare workers, for instance, with regard to their licensures. It gives extended time for them to renew their licenses, to get their educational credits, and we felt at the time that was necessary given the nursing shortage and how we were using our healthcare people in our hospitals, that we needed to have them on the front lines and not in the boardrooms trying to get their license renewed. So what we've decided to do, or the Governor decided to do, was to extend that through the end of the year and give our licensing boards time to take the appropriate action. But as far as the things that have been ongoing through the summer and up until now, the public won't really notice. The vaccines will be available at your pharmacies. They'll be available at your health departments. The Guard, as needed, will still be providing support through those that are on active duty and those that are being reimbursed through FEMA. And the GIAF remains, the Governor had funded it previously through CARES dollars. It will remain in place as a headquarters to operate support for any of those agencies that do need it. Thanks.
Okay, Jordan.
Yeah, Governor, we're done, so we'll go back to you now.
Okay, I didn't expect that. Okay, well, to everybody, again, we appreciate the questions and everything. I hope you understand wholeheartedly. My feelings are just as simple as they can possibly be. We had an emergency. We dealt with the emergency. There's no need in continuing to just drag along with the emergency and everything. It's a time, that we did it. We did what we had to do, and we did it. And I'm really proud of how it was done. You can see all these folks that are speaking and everything, that their level of expertise is off the chart. And so as a team, we've done this, and I think we've handled it well. It's a great time to be able to lift that declaration. I didn't see any reason to make a great big hoopla, as I would say, about doing so. It is not something that I think we ought to turn into a political circus. We just don't need to do that. This is too serious, and it's literally 7,611 people that we've lost and everything. So with all that being said, the last thing I'd end up with telling you to do is just this. And I hope to goodness that we've got lots of folks listening, and especially our media. Dr. Marsh today, and I always take the notes, Dr. Marsh said 31% of the people have now received their Omicron booster shot, that are eligible for their booster shot. He also said that the infectious rate of these variants that are out there right now are off the chart. Now, please, please listen to me, please. The odds of you getting this are really, really, really high. That's all there is to it. As we enter winter, the odds of you getting this are really high. Now, if you're fully vaccinated, you can still get it, can't you? If you've received your booster shots, you can still get it, can't you? I'm living proof of that. You know, Dr. Marsh is living proof to that. Literally, without any question, you can get this. But if you want to reduce your chances of dying on something that you're likely to get, you know, especially if you've not been vaccinated, you're likely to get this. Dr. Marsh said like 170 times more likely than other variants that we've had. You are likely to get this. And how in the world you can sit on the sideline and not get your booster shot? How in the world you can do that when everybody is saying that if you get it, and you're likely to get it, you're likely to get it, if you get it, if you have the booster shots and everything, the likelihood of death is very, very, very small. Now come on, come on. Let me be the guy that's spoken the truth to you over and over and over. Just listen to me. Please, please hear me and hear me clearly. The likelihood of death, if you get this, is very, 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 very small if you're vaccinated. Come on, West Virginia. Absolutely, we want to be super respectful to all their freedoms and everything, super respectful. Going to remain that in every way. If you decide not to do this, that's fine and dandy. But it's my job to tell you that the very best of the best is saying you're likely to get it. And the best of the best is also saying if you get it and you're vaccinated, the chances of death are almost zero. Why in the world are you rolling that dice or spinning that wheel? Why are you doing that? Really and truly, especially if you're 50 and older, you got to get this booster shot. And you absolutely ought to consider, like I said, being vaccinated. And thank goodness we got 4,000 more in the last 30 days. And I would tell you, please, if you've ever done anything in the world for me, and you're 50 and older, get that booster shot. Please do. Thank you so much. Thank all of you.